So we move on to the next paper by Dr. Hughes. Something from Kyushu.
Kyushu is going to very far from here.
He's going to talk to us about neuropathological findings in psychiatric patients with nystagmus.
I'm a Japanese otolaryngologist and psychiatrist, double license. Today I will talk about possible advantage of neurological examination for psychiatric patients. Since 18 years ago, in a Japanese psychiatric hospital's clinical consultation room, we are following up patients with otolaryngologic, psychiatric, and neurologic diseases. Because I live in the countryside, I have to see the three fields patients. Patients with dizziness are sometimes suffering from mental disorders. Also, psychiatric patients often complain their vertigo. She was a young schizophrenic patient and had suffered from vertigo. She had right reading nystagmus. Psychiatric disorders have organic or functional causes involving the brain dysfunctions. Nystagmus could be a side effect of medication. However, nystagmus tests have not been carried out routinely for psychiatric patients. 7 years ago, we started investigating the frequency and characteristics of nystagmus by videography in psychiatric patients. We previously reported that nystagmus observed in 56 of 227 psychiatric patients using videography in the gauge, positional, and positioning nystagmus tests. Nystagmus was observed 20% in schizophrenia, 22% in organic psychiatric disorders, 59% in alcoholism. But not drink alcohol all that time because in the hospitalization. And 20% in excited mental retardation. So we found that there is a significant difference to the control group. Along the use of anti-epileptic drugs, nystagmus appeared 37%. There was no significant difference. The origins of nystagmus in organic psychiatric disorders, alcoholism, or taking anti-epileptic drugs could induce the brain damage. Medication could cause abnormal nystagmus like lithium, Professor Harumani reported, and amitriptyline. The origins of nystagmus in schizophrenia are probably due to concurrent vestibular disorder, brain damage by taking several prescriptions concurrently. Thus, nystagmus may also be a very important clinical finding. However, further neurological tests were indispensable. So, we examined 56 psychiatric patients with nystagmus. Patient group consists of 38 male, 18 female. Mean age was 61.6. Neurological tests included caloric test, vestibular ocular reflex test in rotation, eye tracking test, visual suppression test, pure tone audiometry, stablometry test. This slide shows VR test in rotation. The chair was manually rotated like a pendulum. This is a caloric test result. On both ears, normal showed around 90%. Bilateral caloric test results showed normal response in 75%. Right CP and left CP is in 10%, bilateral is 5%. Then 25% had CP. VR test results showed a normal response 78%. Right CP 8%, left CP 12%, and bilateral CP 2%. Then 21.6% have CP. It's very similar to caloric test results. The results of the eye tracking test result, 8% shows smooth only these are normal. 16% slightly saccadic, 57% have saccadic, 60% ataxic, then 91.8% no abnormal. The visual suppression tests are as follows. In the pure tone audiometric test, on the both ear, 53% gave normal results. Mild, moderate, severe are as indicated on figure. Bilateral audiometric test results showed normal in 47% and bilateral hearing loss in 41%. In total, 52.9% had hearing loss. Stability test results were classified into 4 groups, unable to measure this 26%. The 56 psychiatric patients were classified into 2 groups according to underlying diseases. 14 patients with organic psychiatric disorders, 16 patients with alcoholism belonged to organic group, 25 patients with schizophrenia, 1 patient with excited mental retardation belonged to functional group. These patients were also classified into another 2 groups according to the direction of nystagmus. Central group consisted of downbeating, upbeating, directional changing geotropic, changing apogeotropic nystagmus. Horizontal group consisted of right beating nystagmus, left beating nystagmus. This is a very important slide. In eye tracking test, all of functional group, 25 cases, had abnormal results. Out of 24 functional group, 4 had normal, 20 had abnormal. There was a significant difference between organic and functional groups. In other 3 tests, there was no significant difference. In eye tracking test, all 11 central cases showed abnormal results. But in all tests, there was no significant difference between central and horizontal groups. It was not easy to nail down the origin of nystagmus from the neurological test because we don't undergo the MRI study. But I think the origin of nystagmus were considered as 32 cases were central, and 4 cases were peripheral, and 8 cases were mixed, and 4 cases unknown, and 8 cases were unknown C. There were some papers showed neurological tests for psychiatric patients. The patient with anxiety disorder, somatoform disorder, depression, panic disorder 50%, schizophrenia. This is showed the had vestibular or organic disorders. Depressive patients showed a lower tonic response than normal control. Neuroautological tests are very useful to detect concurrent vestibular disorder for patients with organic PD, alcoholism, panic disorder, depression. Our study demonstrated that eye tracking test on psychiatric patients is beneficial. There was a significant difference between organic and functional groups. Notably, out of 25 schizophrenic patients, 84% had abnormal eye tracking test results. That is a paper. The exploratory eye movement test is very useful to detect schizophrenia reported by the Japanese psychiatrists. And frontal lobe dysfunction was detected in schizophrenic patients. Then, thus, the origin of nystagmus with unknown C group, the 8 cases with slightly saccadic or saccadic eye tracking test results might be due to frontal lobe dysfunction with schizophrenia. Important correlations might be found between vestibular disorder and psychiatric comorbidity about these papers. Acute psychiatric disorder was detected in 68% patient with dizziness. Patients with vestibular migraine and menial disease showed higher prevalence of psychiatric disorder. Therefore, neurological tests are dispensable for psychiatric patients with nystagmus, not to detect vestibular disorder, but to detect possible organic brain disease. In the future, we recommend performing neurological and nystagmus tests with videography for psychiatric patients. I want to try the head impulse test, that kind of patients. Conclusion. Psychiatric patients may have nystagmus, BP, or hearing loss. Thus, neurological and nystagmus tests with videography should be useful. Thank you for listening. And I have two papers, a copy, and if you want, I'll give you.
Thank you very much for this very useful presentation. I think you're both an ENT doctor and a psychiatrist.
Yes, correct.
So your correct title would be a neuro-auto-psychiatrist.
Yes.
That's a very nice title. Please, do we have any questions?
Well, thank you very much for this work. In the 1980s, there was a number of studies that showed that patients with schizophrenia had smooth pursuit eye movement problems. And it may have been not just the patients with schizophrenia, but also their first-degree family members. And so it looks like it may be a trait in families that are at risk for schizophrenia. So that goes along with your ETT results. And so I think that this suggests that when we evaluate patients with psychiatric disorders, the major psychiatric disorders, schizophrenia in particular, we have to be a little bit careful about how we interpret oculomotor tests.
Thank you.
In contrast, the kind of data that are like from Annegret Eckhart-Hen's group in panic disorder, those are one or two abnormalities out of a battery of tests that don't suggest peripheral or central deficits. So they are data that's in a whole battery of tests, one or two parameters are abnormal, but it's not consistent with a neurologic disorder.
Do you have any more questions? Sorry.
Thank you so much for this really important work, and I think from a clinical point of view it's really important to stress out that the patient with a psychiatric disorder can have a concomitant vestibular disease. I see a lot of psychiatric patients with dizziness. I'm only the neurologist. But a lot of them just have BPPV and no one saw it. They changed the psychiatric medication, which made them even more dizzy. So I think this is really an important point, that they also can have something else. Thank you very much.
Thanks.
Okay, thank you very much.
In which case we proceed to the final presentation of this session by whose presentation is entitled The Effective Translation Time Between Eccentric Positions of Ocular Counterroll Patterns and the Subject Visual Vertical obtained during unilateral eccentric testing.
Good morning. I'd like to make a presentation.